Thank you, Mr. Chairman, and thank you to the committee for allowing me to present my research here to you today. This is not the correct presentation.
It's not the correct presentation?
No, it's not.
Okay.
It's the old version.
It's the old version, so we find the new version. So such things happen. Okay, we give it a second go and we set the time back for you, so you're still at 15 minutes. And please.
Okay, thank you. Sorry for that. So AgriHealth is a New Zealand veterinary medicine company which is owned and operated by Kiwis like myself. And we provide technical assistance and research that supports our products, our veterinary customers and the farmers that use our products. So dairy farming in New Zealand is seasonal, with most cows calving in a short period between late winter and early spring, with an average herd size of around 400 cows per farm. So in the concentrated calving period, there will be multiple cows that require treatment for diseases and conditions, and a lot of those will require treatment at the same time. Some of these conditions often need more than one veterinary medicine administered at the same time. In other words, concurrent treatment. So withholding periods generated as a product undergoes registration in New Zealand, and that's based on residue depletion data. We require GLP studies to generate the residue data, but it's based on a single product administration to healthy cows. The important thing is that the data is compared to the local New Zealand maximum residue limit, which is often aligned with international MRLs as well. And these are expensive studies. There's no requirement for residue studies to be undertaken when more than one product is used at a time. So what happens to the milk withholding period when we treat a cow with more than one product at a time? And what happens to the milk residues of that product? Most vets in New Zealand would advocate the use of a non-steroidal anti-inflammatory drug alongside an antibiotic treatment for many diseases and conditions. And there's very little data to support milk withholding periods when these products are used together, or in fact when two different antibiotic products are used together. Vets in New Zealand are lucky that we can use off-label prescription of products for animals where we have a species for which there is no indication on the label, when we use a different dose, when we use a different course of treatment, or where we decide to change the withholding period for the products that we use. But vets must use their own knowledge, any available research or technical advice to provide the information to the animal owner at the time that they prescribe the product. And there is scarce technical information about on which to base any decision to vary the milk withholding period in the situation of concurrent use. So AgriHealth undertook a study to generate some information that would help vets to be able to determine what the effect is on the milk residues of product pairs used to treat animals concurrently. This information was generated not to change anything on the label from a registration perspective, so it was merely technical data. So on 2 dairy farms that were milking twice a day, we tested 19 combinations of products with 5 cows per treatment group. The cows were treated with a full label course of both of the products, and in the case of intramammary products, the cows were treated in all 4 quarters at each treatment time. So these are the 19 groups that we tested, and I don't expect you to read all of those combinations. But 5 healthy cows were randomly assigned to each treatment group. The antibiotic treatments were mostly 3 treatments administered at 12 or 24-hourly intervals, according to the registered label dose. As I said, the intramammary treatments were administered to all 4 quarters at 12 or 24 hours, according to the dose. Meloxicam was administered as a single one-time injection on the first day of treatment, while ketoprofen was administered on the first day and repeated 24 hours later on the second day. After treatment, the longest milk withholding period was applied to the group of cows after the last treatment. Using proportional herd test meters in the cowshed, milk samples were collected at the next 4 milkings after the longest withholding period. And these samples were sent off for testing using LCMS to measure the antibiotic residues only. So we didn't measure the residues of the non-steroidal products that were treated with the cows. The assay of these antibiotic residues was measured and compared to the New Zealand maximum residue limit for each individual cow and for the group mean with a 99% confidence interval. So there's too many results for me to show you all of the graphs, so I've chosen a select few groups to present to you today. So on this graph here, down the bottom of each graph you can see the treatments that were administered, the dose that was given, and the frequency of those treatments. The graph presents the 5 cows from the treatment group with the group mean on the far right and the upper 99% confidence interval. So this assay is for penicillin, and in this case, all 5 of the samples returned a result that was well below the NZ MRL, which is represented by the green line. So in this case, all cows were well below the MRL for this treatment pair. In the case of samples that were returned values well below the MRL at sample 1 after the treatment period, none of the following samples were tested. So in this case, again, you can see for parenteral penicillin with meloxicam injection, all of the samples results from sample 1 returned levels that were well below the MRL. In the case of parenteral oxytetracycline and ketoprofen, 4 of the cows returned results that were well below the MRL, with 1 outlying cow that returned a result that was still below MRL. Similarly with oxytetracycline and meloxicam, all the cows were below MRL. Using intramammary products, so this is a cloxacillin product, with parenteral ketoprofen, again, the cows were all well below the MRL. In some cases, we needed to test 2 actives for the cows that were treated with 2 different types of antibiotics, or an antibiotic product where it contained 2 antibiotic actives. And in this case, you can see both of the actives are still well below MRL. Similarly, this one, there were actually 3 actives that were tested, and they're all below MRL. I could go on. In this case here, this is an intramammary product that contains oxytetracycline and neomycin. You can see that cow number 2 tested above the MRL for oxytetracycline, but the rest of the cows were below the MRL. In this case, this cow was below the MRL at sample 2. Similarly with this product, a lincomycin neomycin intramammary, cow number 3 was above the MRL at the first sample, was still above at the second sample, but was below the MRL at the third sample after the longest milk withholding period. Again, these cows were below MRL for both of the actives tested in this product pair. So in summary, 93 out of the 95 cows involved in the study returned a test at the first sample beyond the longest withholding period, while 2 cows were above the MRL for one of the actives in their products. And these cows were below the MRL at the second and third sample. It's important to note that this data was obtained from individual cows in individual milking situations, and when these cows are present in commercial herds being treated and returned to milk supply, they are within a bulk milk situation, in our case, amongst perhaps 400 and sometimes up to even more cows in the vat. So the data should be interpreted within that milk herd situation. So there does not appear to be any apparent effect of administration of 2 products at the same time on the milk residues when comparing them to the New Zealand maximum residue limit for these active ingredients that we tested. And this data can be used to provide technical evidence to support veterinarians in New Zealand that are applying withholding period information when they're using multiple products at the same time. And I'd like to acknowledge the farm owners and staff that assisted by lending us their cows and their farms for the study, and also AgriHealth for funding the study. Thank you.